Hi, Mr. George. You would like to see your wife? I can help you to direct her to her room. You would like to see me regarding? Okay, I know, Mr. George, it's quite stressful for you, but I cannot divulge any information of the patient without her consent. Yes, I can understand your concerns. I'm really sorry for you. I can understand that what is going through in your mind, but the problem is that divulging any information is unethical and breach in patient's confidentiality. If you were the patient, I would have done the same. Mr. George, don't force me. It's basically against ethical code. I cannot divulge any patient information, even for her husband. It's a patient right, Mr. George. It's a patient right to disclose or not to disclose the information, not a nurse or a doctor. You can take a permission from the patient and you can ask his situation from her. Look, Mr. George, I am telling you that it is permission of the patient. It is not in my control, and it is not. It is against my ethical duty to give information of the patient without her consent, and his breach is in confidentiality and against my oath. So at my situation, I cannot tell you any information of the patient unless the patient gives the consent to you or me, which is written, and then I can give you the information about patient's condition. Yeah, try to understand, Mr. George. I can understand your situation. I'm really sorry that you are suffering from so many things. Everything is going through your mind. You are in a stress. But let me make you understand something. If you were admitted in this hospital, I would have done the same for you also. So if your wife is admitted in the hospital, I have to do, and this is my ethical duty. Breach in confidentiality is not acceptable. I cannot give any information to you, even if you are the patient's husband. And this is as this these are the codes of conduct which is given to me. You cannot enforce and ask me to divulge any information of the patient which I consider the patient wants to keep it confidential. So, what you can do is you can go to the patient, you can talk to your wife, and discuss with her instead of talking to me. This I can understand, Mr. George. You are very concerned, but really try to understand my position. It is unethical and by all means, and it's against the code of conduct of a doctor or nurse. As a health professional, I cannot give any information of the patient without her consent.